Hey everybody, welcome to Best in Health Radio, and it is a pleasure today. I have looked forward to this show for quite a few months. We are talking about the many side effects, health effects of alcohol. And instead of struggling through this with me today, I have a panel of 4 wonderful health specialists who I am going to let them introduce themselves. Holly, let's start with you, Dr. Anderson.
I'm Dr. Holly Anderson. I am a practicing cardiologist in New York City at the New York Presbyterian Hospital, Cornell Medical Center. I am also the Director of Education and Outreach for the Perelman Heart Institute. So most of what I do is take care of people, but outside of that, I go out in the community and try to practice and get people to practice prevention.
Okay. And next, Andy, Dr. Siegel.
Hi there, Andrew Siegel. I reside in Ridgewood, New Jersey, suburbs of New York City, and I'm a practicing urologist working out of Hackensack University Medical Center, which is about 10 miles as the crow flies from Manhattan. I have a general urology practice with emphasis on healthy lifestyle, preventive measures, etc.
Okay. And Michael, Dr. Diamond.
Okay. I really do feel like I'm in Hollywood Squares. So I'm down in the DC area in Chevy Chase, Maryland. And I have a general outpatient psychiatric practice where I see adults for both psychotherapy and for medication. I see a wide range of patients, with severely chronically mentally ill to folks that are pretty much just like you and me. I have a special interest in meditation and kind of a minor interest in Chinese medicine, so that I like to offer people an alternate paradigm if the Western paradigm isn't working for them. And as a psychiatrist, I study lots of substance abuse and substance interference in treatment. So this subject is an important one in my practice.
Okay. And Jenny, all the way from New Zealand. Dr. Connor, welcome.
Hi, I'm a public health physician and epidemiologist, and I'm based in the south of New Zealand in Dunedin, the University of Otago. I'm institutionalized in terms of working in a university now. I do a lot of teaching of public health students and epidemiology students in particular. But one of my main interests for the last 10 years or so has been the health effects of alcohol. And I'm quite involved in a small advocacy group led by physicians in New Zealand to try to get the government to adopt better alcohol policy. So I spend quite a lot of time out in communities talking to people about alcohol, as well as doing research.
Very nice. Well, I'm going to say right off the bat that, Jenny, I think you win the contest here for the best accent. So, sorry, already given that award away. Anyhow, Jenny, you and I recorded this summer, and I like to laugh and say you made me the most unpopular person of the summer of 2016, which I proudly wear, because you had this fabulous study on alcohol causes cancer, which I shared with the world. It was the study personally that I have been waiting for to come out. And right off to start, could you tell us a little bit about, like, anyone can go to the show page and they can listen anytime to our show, but could you talk a little bit about that, please?
Well, I was invited to write that paper because of, I guess, a lot of misinformation that's out in the public about alcohol and cancer, but also lack of information. And even amongst alcohol researchers and practitioners. And so the addiction journal asked me to write and explain, really. And so in this paper, there's no new evidence. I haven't done a primary study that's the focus of this paper. I've tried to summarize a whole lot of different pieces of the story about alcohol and cancer. So a very brief discussion about the biology, which is not my strong suit, and a bit more about explaining how epidemiologists come to conclusions about causation, because I think it's not easy to explain if you don't have any background, but at least I think we should try to lay out how we come to such a big conclusion. But as I say, it's not that we didn't know this. It's just that the knowledge was somewhat sequestered in a scientific circle rather than out amongst the public. And so it was trying.
No, I've read these studies so many times over the years, but in that short span of time, you kept firing away. Again, this is, you specialize in the health effects of alcohol. You kept firing away all of these many, I don't know if it's even fair to call it side effects, these issues with alcohol and our health. And that's what actually inspired me to do this show. So I thank you for that. And I would like to start here with Holly. Holly, being a cardiologist, please forgive me, I look at the heart as Grand Central Station. I mean, you have to understand, I work with what I do with a lot of people who will know every single thing about the Kardashians and who won every award in the Emmys last night, but they really have very little understanding of heart health, never mind the liver that you're going to get to. I mean, so it really is in so many ways the crossroads, Grand Central Station of the body. So can you please talk about the many issues with alcohol and the heart?
Well, first of all, I have to say that everyone has to realize that heart disease is the #1 cause of death for both men and women in this country and now worldwide. And more women have died from heart disease every year in this country since 1984 than men, with the exception of just the last year. So I think men know this. I don't think women know this. And more men and women have died from heart disease than all cancers combined, and more women die of heart disease than breast cancer at every age. So it is our biggest health threat. And I think actually the cardiologists have been one of the ones that have been spreading the good news, if you will, about alcohol, because they're the epidemiological or population data that comes in says that, you know, men and women who drink, for men 1 to 2, for women 1 glass of alcohol a day, tend to live longer. And I think that misses the big point, which is alcohol is the #2 cause of preventable deaths in this country, second only to smoking. And in each individual, we know that alcohol can increase blood pressure, increases your risk of obesity, increases your triglycerides. It can cause, in some people probably who are more genetically predisposed, to develop weakened heart muscles that we call cardiomyopathy from the bottom part of the heart. It increases your risk of stroke. And there was a paper that was just released last Friday that said it probably has effect on the top part of the heart and makes you more at risk of a rhythm abnormality called atrial fibrillation, which greatly increases your risk of stroke. So I think that people have to understand, and you can get into the cancer's effects, if this drug, which alcohol is, can cause cancer, it also has these multiple potential deleterious effect on the heart. So what is with the 1 to 2 glasses of alcohol a day in the population? And I can get into that. And I think that that's one study looked at the fact that people who drink small amounts of alcohol, like once a day, not your 14 drinks on Saturday night, but you know, you have a small amount of alcohol, say before dinner every day, which is more of a ritual than even social drinking, right? Most of these people are probably doing it with their spouses, or so it's a ritual. Then they tend to live longer. Well, these people, if you look at them, have less risk factors overall than non-drinkers. Okay, overall, they are doing these other things that are probably good. They're higher socioeconomic levels. They probably, then it's a social event. It's a relaxation event. It's a routine, and bodies like routine. So we're probably giving the credit to alcohol when the credit isn't the alcohol, it's probably the whole ceremony of taking a moment out of your day and actually having
Right.
the ability to do it.
Right.
So can I ask a question? So it's not the resveratrol and the.
Well, I think that's the other part of it. That's a very good point. There are some alcohols, okay, red wine in particular, and the red wine industry has been all over this, contain antioxidants and resveratrol that we know are good anti-inflammatories, good antioxidants, good things for you. But that comes from the skin of a red grape. It doesn't come from the alcohol. So you can get it in grape juice, you can get it in, now there are some drug companies, right, that of course are trying to put that into a compound and sell it as a supplement. But again, we try to do this. You talk about alternative medicines, or there are people that are trying to take a tea and take the active component of a tea that we know in China and put it in a pill, and that doesn't work. But the whole ceremony of sitting down with tea that's maybe steamed and sitting there and having it with people, that's probably the way it works. And what part of that is the health benefit? It's sometimes hard to distill. I also meditate, by the way.
I have read the amount of resveratrol it takes to have any benefits whatsoever. Anyone else read the same number as I have?
No, curious.
2 bottles of wine, 2 full bottles of wine to have any kind of impact, not even enough, but to start feeling the benefits of the resveratrol is the stat that I've read is 2 bottles of wine. Now, I think the rest of our body would have something to say if we drank 2 full bottles of wine.
And just to comment on that, alcohol comes in a liquid that's also filled with sugar. As you look at the most, and I know we can get into cancer research and what just came out from the sugar companies' interference with research in Harvard many years ago, is that the biggest researchers I know at Rockefeller in cancer and heart are now looking at the effects of sugar on being a pro-inflammatory and causing disease, both heart disease and cancers.
It's about time they came out with that.
Mm-hmm.
Really,
I think,
about time.
if I could make one other comment, this one of the things I was trying to get across in that paper, I was trying to explain everything at the same time, and I'm not sure it all worked.
It did.
Was having a biological mechanism that's plausible doesn't mean it's causal in terms of the population at a big scale. So resveratrol may indeed be good for your heart in some way, but it's not on the same scale as the damage that's being done from the alcohol that accompanies it. And all of those epidemiological studies that show that people who drink small or moderate amounts live longer they're all affected by this idea that we have a biological mechanism for how that might work. So people are more likely to believe those studies because they can see the effects of alcohol on your lipids or your platelets, stickiness or whatever it is. And they can say, here is the mechanism, it matches these epidemiological findings. But in fact, when you take the studies apart, you find that they're really very flawed and there's plenty of scope for other explanations. Those people who drink small amounts in a regular way, as Holly was saying, are different people. And one of the interesting things about the ritual of having, there's almost nobody in New Zealand actually who drinks in a pattern of 1 or 2 drinks a day regularly. It's a very small proportion of the whole population. But with couples that do that, particularly as they age, when one of the partners dies, the other one usually gives up drinking because they're not really, they're doing it together.
Really?
Again, the social, it's the ceremony, it's the routine, it's social, the communal things. And there is another model that we know that hormone replacement therapy used to be considered by the cardiologist. Well, we noticed that women who took hormone replacement therapy lived longer with less cardiovascular disease. So we then did a study, and guess what? It was just a marker for those women who cared more about their health, had higher socioeconomic status, went to their doctor more, and actually it was more causative for heart disease and cancer. And it was just a marker of those of that group of women who probably took care of themselves better.
Yeah. And we know that being married as you age, generally speaking, is good for your health and you will live longer. And so it may be as simple as that in terms of sharing drinking.
Part of the problem, I believe, too, is people don't read studies as in reading your study. What they're reading is the little melodramatic snippets that the media takes out of it and wants to promote. And I know when I read studies, yeah, I'll see it in the newspaper and say, okay, I have to look up this study. And that's what I use it for. But unfortunately, I think that's a serious problem we have there too. Holly, I'd like you to tell everybody, we talked about it right before the show, your statistic that you always talk about with women and breast cancer versus heart disease.
Yeah, well, I'll mention it again. More women die of heart disease in this country than all cancers combined, and 1 in 3 women right now die of heart disease. And
1 in 3?
when you add cardiovascular disease, all of heart attacks and stroke, it's probably 1 in 4 of heart disease and 1 in 3 of cardiovascular disease and stroke and heart disease. So, and that's more than all cancers combined in this country. And women are more likely to die of heart disease at every age than breast cancer. So it's not just a disease of older women. And what's concerning me the most is heart disease is now increased. Overall deaths increased for the first time in the United States last year, and more heart disease deaths increased last year. But when you look at the population with respect to age, heart disease is now increasing in our youngest adults and increasing faster among young women.
Is there an explanation for that?
Well, it didn't tell us that. I would say a few things. Our population is becoming more diverse. But, African American women have greater risk. Hispanics, probably not.
Higher rate of diabetes.
But there's a lot of more risk factors in the younger population. So hypertension, obesity, diabetes, sedentary lifestyle, I would say stress. And if you wanted to ask where I really felt, I think it would be our food supply that has more sugar and processed foods in it than any other time in the history of the world.
And diabetes has skyrocketed.
Yes.
So, okay.
So are you looking at alcohol as a source of sugar and therefore?
I don't necessarily know or think that drinking has increased in the young adults.
Jenny, what do you say about that?
No, I'm not familiar with the US figures, but certainly New Zealand, Australia, and the UK, the youngest groups of young adults, so teenagers, are drinking less for the first time in a long time.
Wow.
It's unclear what that pattern is. Hazardous drinking in New Zealand hasn't changed in terms of prevalence in the whole population, but we're looking at I think an aging cohort. So the people who were very heavy drinkers when they were young are still quite heavy drinkers as they're middle-aged. And the young people coming behind them seem to be drinking less. There's a lot of research to see whether that's about polarization, whether some young people are not drinking at all and others are drinking more. But it doesn't seem to be what's happening. There seems to be a genuine decrease in the very youngest that we measure.
Jenny, can you please share with us the highlights, sounds funny calling it highlights, of your study and your findings of alcohol and cancer? As I say, this paper got a lot of publicity for me having discovered something new, which is completely not the case. Correct.
My favorite piece of media coverage was the British Science Media Centre, who had two eminent professors from London saying, "What's all this about? We know this." And I felt slightly belittled that they hadn't read the paper, because it was really about trying to explain rather than trying to say something new had happened. But there's been evidence for a considerable period of time that at least 7 different sites of cancer have a causal association with alcohol. And they're the ones we knew about when I was a medical student, like cancers of the head, neck, the mouth and throat and esophagus and so on, usually seen, I first met them in ENT clinics where older men usually who were heavy smokers as well as heavy drinkers had these cancers. But since that time, there's been increasing evidence about cancer of the bowel and breast, and that's been a big change, I think, in thinking, because these are very common cancers. And although the associations with alcohol are not as strong, there are more cases because these cancers are common in the population. So it was partly about setting out those things. As I say, a very brief description of what some of the biological mechanisms might be, just really to illustrate that this work is going on. But then it was trying to make the case that although we largely have to use cohort studies to look at alcohol and cancer, which are, obviously have serious limitations in terms of causal associations. They're the best that we have, and trying to explain why, on one hand, you can say from these studies alcohol causes cancer in more or less the strength of association that's measured, whereas the same studies don't very strongly support the protective association of alcohol with cardiovascular disease, because this lies or explain some of the criticisms that are constantly made of the things that say in public about alcohol and cancer. So, I think there is continuing work on how those cohort studies that show a protective effect for alcohol and cardiovascular disease, what the flaws are in those studies, or what the doubts about those studies are, which I was discussing before, that will make it look like there's a protective effect when probably present, whereas the cancer effects can't really be explained away in a similar way. The only other thing that I think it adds, and I've said this in other forums, as a public health person, the question of whether alcohol protects against cardiovascular disease is really not part of the discussion in terms of public health. I'm quite happy to accept that we don't know the answer to that, and there may be a benefit for some people. And I think the state of the evidence at the moment is that there may be a benefit for some specific groups of older people who drink in a particular way that's not all that common in my country. But even if that was true, you would never promote alcohol to reduce cardiovascular risk, because we've got so many ways of doing it. It's partly because alcohol is a dangerous thing to get people involved in if they're not otherwise a drinker anyway. But also, there are just better ways. The standard treatments for reducing cardiovascular are starting with lifestyle and moving into these really very safe medications.
I don't think there's any preventive cardiologist that would tell a non-drinker to start drinking.
Yeah.
There are, but there really shouldn't be, and that you have to be very careful. And I think that alcohol has been shown to be have detrimental effects on the cardiovascular system. It causes high blood pressure. In binge drinking, right, it causes the so-called holiday heart around the holiday times. In binge drinking, it causes people who've never been in atrial fibrillation to go into atrial fibrillation with perfectly normal hearts. In some people, it has toxic effects on the heart such they kill heart muscles. They die, the heart muscle cells. And I think as we get into precision, personalized medicine, and we understand genetics as we go forward, we're going to see there are some genetic populations of people that are much higher at risk than others from this. But I do think it wouldn't be hard, and there are some studies to suggest this, as you know, that all the health benefits of alcohol are in this moderate way are really bestowed on the ritual effect. Even taking time out to take a time out of your life to relax at the end of the day and give yourself a few minutes. We know that we talked about meditation. We know that it's probably a good thing before you get in the car on the ride home to sit there with the keys in your hand for a few minutes to let the constant buzz in your head stop. So there's been no study to tie the health benefits to the drug alcohol. It's just in a subpopulation of people who enjoy it in a certain way, they tend to live longer.
Jenny, you mentioned something else in the study that I want to make sure gets said today. I think this is a really important point. I can so far believe that there are people listening to this that'll say, oh, that's only if you're a drunk. That's only if you're an alcoholic. That's only if you're drinking large amounts. And I remember you were talking about studies with breast cancer in particular. You know what I'm getting at here. Okay, where it was really surprising that when the breast cancer was attributable to drinking, or it was part of it, it wasn't that they drank that much at all.
Yes. Yes. So the research literature about alcohol and cancer in general, that's been very well summarized by people other than me in meta-analyses and so on, suggests that there's no threshold for alcohol drinking and it contributing to cancer. But it's seen more clearly in some sites of cancer than others. And with breast cancer, the mechanisms by which alcohol is contributing to the cancer seem to be somewhat different than from, for example, cancers of the head and neck. And so when you look at the breast cancer studies in particular, it's clearer that there's an effect at very low average doses of alcohol. So all of these, one of the weaknesses of these studies is that they average people's alcohol intake across the week. And sometimes when we're talking about so many grams of alcohol a day, it actually is all being consumed on Friday night. But if we have to leave that aside for the moment, with breast cancer, you can see at quite low doses of drinking that there is already an effect that's different from zero. So at 1 drink a day, for example, on average, 7 drinks a week. Right. There has been a meta-analysis that was done that looks specifically at low-level drinkers, and the most obvious effects here were for breast cancer. So I think what you were referring to possibly was the New Zealand study that we did. We did a burden of alcohol study in New Zealand using the methods of the global burden of disease, what they call the comparative risk assessment. And I'd like to preface this with the fact that that we have relatively small numbers. We're a relatively small country, about the size of a small American city. But when we did the calculations, we attributed half of all the cancer deaths in both men and women to drinking less than 4 drinks a day. So these are New Zealand standard drinks, so less than half a bottle of wine a day. Having said that, half a bottle of wine a day is actually quite a lot if you do it every day. But in breast cancer in women in particular, a large proportion, about a third of the breast cancer deaths, alcohol-related breast cancer deaths, were attributed to women who drank 2 drinks a day or less. And so I have to say there may be a reasonable amount of uncertainty in those figures, but it's a large proportion. And these are women who have no idea that their drinking is doing them any harm. Women who may never get drunk and who never feel like they're not exceeding the New Zealand guidelines actually, which at the moment say up to 2 drinks a day for women, but with 2 days off, which is an interesting non-evidence-based addition. And it's to try to encourage people not to drink every day because of the escalation of drinking. If you drink every day,
dry out for 2 days.
Well, just to keep it in the back of your mind that you don't want to have a habit that's going to increase. Yeah.
Right.
So women in New Zealand who drink within the guidelines are still at measurable risk of alcohol-related breast cancer. Breast cancer.
Wow. Andy.
Yes. Hi there.
Hi. Being my urologist that I quote probably a minimum of 10 times a week in my own business and your many fabulous books, can you please talk to us? You also promised that you would talk about the liver, because I think the liver really needs to be discussed here. First of all, I think I'm going to ask you to explain a little bit about liver function and what the liver does, and then relate that to, again, what alcohol does to the liver.
Sure.
And then we'll talk about sex.
Okay. Fair enough.
Okay, go for it.
All right. So first of all, the liver is a pretty sizable organ. It weighs over 3 pounds. It's a substantial organ. I think any organ in the body that is not paired is a very important organ by definition. Heart, liver, brain, penis, etc. Uniquely, when damaged, to some extent, it can regenerate. It's one of the unique properties of the liver. It's got many functions that are fundamental. First and foremost, like the kidney, it filters the blood constantly, removing toxins and wastes. It's intimately involved with nutrition. It secretes bile that helps absorb fat. Glucose is stored and metabolized in the liver in the form of glycogen. So when we exercise, after we burn off the glycogen in muscle, we then utilize the glycogen in liver. It's responsible for regulating blood clotting, and liver disease can cause abnormalities with blood clotting factors. It helps the kidneys. It manufactures urea, a waste product, for excretion by the kidneys. It can manufacture protein under certain circumstances. The liver is responsible for cholesterol production, which is important for the manufacture of testosterone and estrogen and progesterone and all the steroid hormones. So on many levels, it's a fundamentally important organ. As far as alcohol, like sugar, can be considered a toxin to the liver. Interestingly, sugar and alcohol are really getting placed in the same category. The very first phase of hepatic disease, liver disease, is usually a fatty liver, which is an accumulation of fat cells in the liver that's abnormal. Exactly what happens with diets that are high in sugar. And in fact, in the manufacture of pate, they are taking geese, putting a funnel down its esophagus, and pouring cornmeal and high levels of carbs in order to create a fatty liver for that purpose. So that's typically the first level of.
Yeah, how happy I am. I don't eat that stuff right now.
Yeah.
Okay, go on. Yeah.
I don't like liver myself. Something about liver and kidney, never. I can't do that to urologists. So that's what happens. That's the initial insult to the liver from excessive alcohol. It's a fatty liver, very similar to what you get from excess carbohydrates. Very similar to what we see. We see a lot of patients who are routinely imaged with ultrasound or CAT scan for something, and commonly on the report is fatty liver. Patients ask me, what is a fatty liver? I try to explain it in a nice way, saying it means that you are very well fed. And basically it is potentially reversible, with diet and exercise, that it can be reversed generally. The next phase of damage is known as alcoholic hepatitis, which is basically the hepatocytes, the liver cells, get inflamed and ultimately destroyed. And this is seen in probably 50% of heavy drinkers, and it's potentially reversible, but not totally reversible. And if somebody continues to drink heavily for years and years on end, they will ultimately end up with a condition in which there is scarring of the liver cells, commonly known as cirrhosis. And that's seen in probably 25% or so of heavy drinkers. And the problem with fibrosis or scarring in the liver is that it impairs the function of the liver cells. You end up getting high blood pressure in the portal vein that brings nutrients into the liver, and you end up getting varices and esophageal and stomach bleeding and portal hypertension, and ultimately renal failure, and a whole array of metabolic issues. So that's liver physiology 101.
Okay, so just to make sure I understand here, people often drink, they get drunk, they're hungover, and they believe when the hangover is gone, the damage of the alcohol is gone, which we know is not true. So for alcoholic cirrhosis of the liver, in terms of the liver's function, performance for what it needs to do for the body, or hepatitis or any of these things, what does that mean?
I mean, the liver is a dynamic organ that is extremely metabolically active on the cellular level, very important for cellular respiration and metabolism. And when there is scar within, when there is diffuse fibrosis, the cells just do not function properly. There's impaired function. The liver becomes a big mass of non-functioning scar tissue.
Okay, now, my favorite part. Andy, you have 2 fabulous books out on sexual health, of course, with exercise, but that's, So please talk to us about alcohol and sexual function. And the reason I'm saying this is just so important, let's face it, that's something that people will listen to if it's something that threatens their sexual health. Maybe I'm making a generalization there, but I think that's something that talks to people, that like, yeah, okay, the liver. Yeah, okay, well, my heart's still ticking. Unfortunately, people are like that. But let's talk about sexual function. Well, we know about high blood pressure, which obviously is going to handicap performance. But please go ahead and talk to us about alcohol and sexual function.
I mean, our sexual organs are really extensions of our cardiovascular system, and anything that can impair that, as was so well stated, can affect peripheral vascular structures like the genital organs as well. I think, and some would argue with me here, but observational wise, in very low doses, with very moderate use, it can sometimes actually help a situation insofar as alcohol can reduce anxiety, performance anxiety, and it can act as a vasodilator, actually increasing blood. But that's just, a very mild amount of alcohol. At higher levels, clearly it can impair sexual function in both men and women. It can affect the ability to obtain an erection, to maintain an erection, to ejaculate. There are all sorts of slang terms for the effect that alcohol has on one's sexual function. One that's bandied about a lot is brewer's droop. But
I have to say, I've never heard that one, okay?
Alcohol to sexual function is not unlike what tobacco is like to sexual function.
And not to mention obesity.
Exactly. So it's a real issue. Additionally, chronic alcohol use in both sexes can affect reproductive hormones in a strong way. Classically, alcoholics have low testosterone levels related to the way metabolism, the way alcohol is metabolized, and the cellular damage from the alcohol. So on many levels, I mean, alcohol is going to affect every organ system in the body, every cell in the body. As far as the urinary tract, I mean, we see ramifications there as well. I mean, alcohol acutely will inhibit one of the pituitary hormones, anti-diuretic hormone, so one ends up having a diuresis and urinating a lot, urinary frequency. And for chronic heavy use of alcohol, we can see symptoms of overactive bladder, urgency, frequency, getting up a lot at night to urinate. So it strikes the urogenital tract particularly strongly.
Right. Okay. Michael.
Yes.
I saved the psychiatrist for last. There are a number of things, and I welcome everyone else to join in here, that I would like you to discuss. First about is cognitive impairment, sleep issues, but most of all, you've heard what everyone says here. I would like you to talk about, again, as I said, I call it rationalization, that I see so many people every week and coaching and the arguments over alcohol and why it's good for you. And it's something that people just they want to believe, just as, I don't know, like the very fabric of existence is defending alcohol. So please talk to us.
I think it's been a joke in our culture for centuries. I never heard brewers droop, but it's in Shakespeare, it's in Chaucer, the funny drunk, and which, on the one hand can be looked at as an object lesson. Well, this is what happens when you drink, but it's really not. Doesn't end up that way. It really just ends up a common joke, and oh well, you had a bad night, and nobody thinks about the fact that that bad night has ongoing repercussions. And a couple of bad nights a month or a couple of bad nights a week begin to add up to a bad brain, a bad liver, a bad heart, bad kidneys, all the parts of the body that are affected by alcohol. As a psychiatrist, I'm constantly trying to persuade people to just experiment, see if you feel better. If you take a month where you don't have that 1 or 2 glasses of wine with dinner every night, because I'm seeing people who are trying to do all sorts of things to treat their depression and anxiety. But you're right, they don't want to give up their 2 glasses of alcohol. And especially in Washington, it's a major anti-anxiety drug. And it's also an important ritual, although I think the days of the 3 martini lunch are probably gone. But even that, that was a common joke. And there's still a new generation of kids that has grown up watching Mad Men on TV, and that cultural example still somehow seems to be appealing. The idea that you stay a little bit lubricated and you're cool. The use of alcohol as an anti-anxiety drug usually has just the opposite effect. So I don't know how useful it is to talk about the effects of alcohol on neurons, but what's happening is you're basically depleting the brain of all the essential neurotransmitters. Alcohol is very non-discriminating. It crosses most membranes. I'm not sure where that came from. It crosses most membranes, and it acts as what's called a secretagogue. So it dumps out serotonin, norepinephrine, dopamine, which is why the person gets a little bit of a buzz when they have a drink. And then when they're under stress, not sleeping so well, taking stimulants, they don't replete themselves completely. So the next day they may not be as happy. They may be a bit more anxious, just from that 1 or 2 glasses of wine. And if they're doing it every night, they don't catch up. And so they would prefer to be on Prozac or Zoloft or Lexapro rather than give up those 2 glasses of wine. And since the way medicine is currently practiced, it's actually cheaper for insurance companies to pay for the SSRIs than it is to pay for psychotherapy, stress management, acupuncture. This is the way we've gone, and I prescribe and I do psychotherapy.
By the way, it's a lot quicker for doctors to prescribe Lexapro than to get into all these issues with their patients too.
Oh yeah, absolutely. And actually, a buddy of mine who's an internist and actually at Cornell Weill says that it's a big problem just to get a referral into the mental health network, because there's insurance barriers to getting into that. So our society is tilted in favor of giving people substances, whether substances that they buy at the liquor store or from the pharmacy. The effects on sleep, I think most people have had the experience of having a few drinks before they go to bed at night and then waking up every couple of hours because alcohol disrupts REM sleep. So normally you'll go through a cycle of sleep every few hours, every 2, 3, 4 hours, which will terminate with REM, which protects you from waking up. You're actually stimulated in REM sleep, and you're having dreams, but your body's not moving, and your sensory portals are shut down. And you stay in a sleepy state. You dive back into deeper sleep. With alcohol, instead of that, you wake up and you look at the clock and you say, "My God, I just went to bed 2 hours ago." And you wake up in the morning not feeling rested. That's a very common effect of alcohol and sleep. Alcohol, in the long run, also impairs memory and cognition. I don't know the figures on exactly how much alcohol you have to consume on an ongoing basis. I can just tell you from clinical observation that when people stop drinking every night, their cognitive abilities improve. Alcohol has a direct toxic effect on the mammillary bodies, which are involved in the formation of memory. And it may also have to do with attention, because if your serotonin and norepinephrine are running low because you're constantly depleting it by dumping it out every night with a couple of drinks, your ability to sustain attention and therefore register things in memory is going to be impaired. So that's a short answer.
Okay, now the hard part. Why is everybody rationalizing this?
That's easy. It's fun. I mean, people live their lives around pleasure. And for some people, I know in Washington, this is a town of workaholics. For whatever people say about the federal government, people actually work really hard around here. And it's very common for people to maybe get 6 hours of sleep a night and go into work early, leave work late, long commute. So the one thing they look forward to at the end of the day is that couple glasses of wine. That's what gets them through.
And I think that sometimes it's not just strictly on a drug-related basis. I mean, people enjoy the taste of wine. They enjoy a beer. It's a little bit different from a pill in that respect.
Can I just say something
Please.
about the broader picture? Because I think touching on a whole lot of things about the way alcohol affects your psychological life, if you like, and your sleep and so on. And as each of us has talked about these different aspects of alcohol, we're talking as if people live in a vacuum, that we're only talking about the drinker. And we're not so good at, I'm a measurer of things, that's my job, but we're not so good at measuring the effects of the way we drink on other people. It's difficult to find the measures to do that. But there's no, in the world that I work in, there's a complete consensus that the amount of health harm from alcohol is greater in people other than the drinker than it is in the drinkers themselves. And so, because we're talking about, for every one of these workaholics or at the other end of the scale, people who have nothing to be happy about, who drink, everybody else is affected by them, everybody else they come in contact with, but also they dismantle their own social life in the worst case. And if you think about drinkers in particular, where the personal damage is the most marked, it's also the social damage and the damage to other people is most marked as well. And we know that there's a raft of problems that children of heavy drinkers have. Their life opportunities are taken from them. Their parents have difficult relationships if they survive at all. these things that create another whole generation of health problems for young people that they're going to have to deal with, and often on their own. But alcohol also fills our jails. You know, I mean, we can't claim any superiority over the United States in this regard. I mean, we have fewer incarcerated people, but about half of them are in jail because of alcohol, one way or another. So either because of its involvement in the crimes that they were committing, or because they were ASD before they were born. And when you start measuring that in prisons, that's what's going on. You know, the cost to the community as a whole, I mean, if you want to talk about the economic cost, it's much greater in those non-physical health ways than it is when we focus on the physical health of the drinkers. But there's a lot of low-level damage that doesn't result in people going to jail or children having FASD, but causes families to function poorly and causes the education system to function poorly, and we're always playing catch up.
Well, think of the contributions to motor vehicle accidents, and it's one of the biggest contributors to domestic violence, and you know the epidemic we're having with campus date rape.
Yeah. So interestingly,
I think, I'm sorry.
The situation with the student drinkers, which is one of the areas that I study, I have some collaborators in California where we've compared student drinking in the two places, and the New Zealand students on average drink much more hazardously than the California students. But issues like violence and date rape are well and truly more prevalent in California than they are in New Zealand universities. And this is one of the things that we really want to study, because you need to get under the skin of these figures, because we can't say that alcohol is the only thing.
But drinking is glamorized. I mean,
Yes.
I know, and you might, personally believe that drinking is glamorized. I don't know if it's because of television. I don't know why. And that kind of goes hand in hand with my other point to you, Michael, is the fact that people don't acknowledge that they're drinking too much. They all think they're social drinkers. So if you talk to someone who's having 2 glasses a day, or, you know, never mind even trying to handle the ones who have 1 glass a day or more, no one ever accepts. Maybe, and I think personally, in my layperson's way, it's because it's just so heavily glamorized. For kids, it's, I'm a grown-up. I'm free. I don't know. I'm free of my parents. I mean, whatever it may be. And I think that is a huge part of our problem. And I don't know if getting to them with this kind of research that we're bringing to everybody and scientific fact, but I think part of the issue is we have to take the glamour out.
Well, I have an opinion on that. The glamour of drinking is deliberate construction of the alcohol industry, and the international alcohol industry $3 billion a year. So that's reflected by all the people around people when they're learning about alcohol. So take it out. We can take it out by regulating.
Other people hear voice.
Michael, sorry, I can't hear you.
I was just saying,
Okay. So can you discuss with us, please, a little bit about this not accepting of what we're doing, not accepting that we're above the recommended limit?
Well, I was looking up to date the website recommendation for various medical conditions by the experts, and in that particular article on alcohol, on normal alcohol use, the summary and conclusions, I should get back to it, but was that moderate alcohol use has health benefits And then it cites Jenny's work as it may increase the risk of breast cancer in women, and then it also mentions what Holly said about the positive effects and cardiologic measures are maybe due to other factors. But those are at the bottom of the page. The bulk of so if this represents what our field is saying, our field is basically telling people moderate drinking is okay. And what's moderate drinking? Moderate drinking is, heavy drinking is 5 drinks or more. So moderate drinking is 4 drinks, half a bottle of wine. And of course, most people drink less than that, so they feel okay about it. And I think the struggle is to really throw away any kind of absolute standard and try to get people to look at what's the effect of what they're doing on what's going on in their lives now. Because if you try to create any kind of a universal measuring stick, you're going to fail because people are different. But if you can get an individual to look at the effect of what they're doing on their lives rather than compare it to other people, you might have a better chance. As soon as we try to say this number of drinks is normal, we're going to lose.
Any other thoughts? I've seen all of you kind of wanting to come out with something and say something. Go for it.
Well, it's just interesting that we really have the scientific information that alcohol causes cancer. It's probably, it's irrefutable in some cancers. And I don't think the majority of the population knows that. So we, as a healthcare professional, that message is not really being told until you have breast cancer, really, then you find out about it.
You know what, Holly, and I know I'm opening a can of worms here. I think there's a lot of things that healthcare professionals don't let us know about. And I think you and I have had this discussion many years ago that there's a number of things out there that, I mean, I know with most people, you're talking a typical doctor's appointment of 10, maybe 15 minutes, but there's a lot of information out there that should be conveyed. For instance, I remember when I was a kid, a very young kid in my pediatrician's office, there was this, everyone's seen the poster, I'm sure, it's a don't smoke sign. This old, shriveled up, scary looking woman. She used to give me nightmares. I would literally come home from my pediatrician's office having nightmares. And it says, smoking is very glamorous. Does everyone remember that poster?
Yes.
Okay. And so we've known for a very long time. But still, it's just, when knowledge, it just doesn't make it out there because
everybody knows that alcohol causes birth defects in babies, right?
No, I don't think everyone does know that.
Only one good thing that how can something that can cause birth defects in babies be healthy for the rest of us?
I think we need a much better education in terms of middle school and high school, because that's where it all starts. And that's where alcohol is glamorized and abused, at least in my area of the country. And I think a lot of kids don't have a clue about, the long-term ramifications.
But do kids that age care?
Maybe not.
Can I just say there is a lot of research on using education in kids drinking or to prevent them from drinking. There is no evidence that it makes any difference on its own. And so, I mean, I am certainly an advocate for educating children about alcohol as well as many other things that could cause them harm. But it needs to be backed up. Children are growing up. And you can't take those children out of their families, but you can take them out of the super saturated advertising world where alcohol is not only glamorous, as you were saying, but it's everywhere. It's every time you turn around. It's part of your life, and particularly the global young alcohol culture is now something. When kids are looking for something to identify with that doesn't look like their parents' generation, the companies have provided this for them. And if you go to Europe, if you go from the US, we'll see the same advertisements, and they're And it's all through the social media. It's obviously all through Facebook as well. This is something that young people can belong to. So we need to change the environment. And the approach in New Zealand is to try and change some of the regulation as getting rid of marketing and advertising of alcohol. But when you change the environment, people will drink less. When alcohol is more expensive, they do drink less. The addicted drinkers drink less. The moderate drinkers drink less or drink nothing. The children drink less. These are things that we know work, and we need to use some of those. And then the education will be helpful when the children have some support.
I think we also have to get those myths out there about a glass of wine a day is good for the heart, et cetera, the many that we've spoken about the last hour. I think we also need to get those out.
Yes. And I do think that amongst the young people, and I'm not saying across the board because there are big inequalities amongst young people like there are in other things, there is a growing group of very health conscious, educated, articulate young people. And I think they can be opinion leaders in terms of some of these things that are good for your health and bad for your health. And I think that's, so
the music that's out there that does glorify alcohol. And for all the young music, most of it, pop songs and rap and hip hop, all glorify
alcohol and cop killing. Yeah.
And other antisocial behavior.
It's hard to compete with that.
Teenagers are about.
But at one point there was smoking in a lot of movies, and at least we've gotten that out. So we're starting somewhere. We've got to start somewhere.
Yes. I think one of the theories about the youngest drinkers not drinking so much, or not so many of them taking up drinking, when they're 14 as they're used to, is that it's rebellious. Their parents are the heavy drinking generation, and the children have grown up not liking it sometimes, in some situations, and feeling uncomfortable with it. And they're rebelling by not doing it. And that's one of my particular favorite theories, but I don't know how much evidence there is. There are a lot of different ideas about what's going on.
Certainly seen that in individual families.
Yeah.
But are they turning to pot instead?
Yeah, well, we haven't got another hour to talk about that.
Okay, so at this point, I'm going to say to everybody, thank you very, very much for your time. And what can I say? Let's all keep up our very best efforts here. Holly, thank you very much.
My pleasure. Thank
Andy?
you.
Always.
Michael?
Yeah.
Jenny? And I will show up within a couple of days. And what can I say? Let's all spread the word, and thank you very much.
Nice to meet you guys.
Likewise.
Yes, you too. Yes.
Take care.
Take care, everybody. Bye-bye.
Bye.